PCSK9 inhibitor is a medication that's been around for about 5 or 6 years now. It comes as an injection medication, and it is specifically targeted against a protein which can reduce the numbers of essentially scoops which remove cholesterol from the blood. And we want as much cholesterol removing as possible going on in the body. So if we can increase that amount of cholesterol that's being removed from the blood, then actually the blood concentration lowers. And the PCSK9 inhibitors are targeted against this protein. So in effect, it allows us to lower the cholesterol by a specific targeted mechanism.
So the patients that would benefit from the PCSK9 inhibitor are those who've had a cardiovascular event, so something like an MI or a stroke, and they're intolerant to statins. So they may have tried several different statins and had different side effects to them. The PCSK9 injections are given 1 injection every 2 weeks. It's an injection that you keep in the fridge. It's a very easy to use injection. It's a single-use auto-injector pen. You can choose whereabouts that you inject it, so you could use the top of your arms, for example, or around your tummy, or the top of your legs. When you've decided where you're going to inject, you place the pen on the area and press the start button. And then the pen has a window that changes colour, and when it's completely changed colour, that's an indication that the dose is complete. And then you also hear a click sound, and that's a second indication that the dose is complete.
Prevention strategy in terms of either primary prevention, stopping an event happening, or after you've had an event, trying to stop this happening again, it needs to be something that's fairly straightforward for the individual. Having a medication that the individual is, if you like, in control of, doesn't need to go to a healthcare setting for administration, can get a delivery of these medications that lasts a number of months, then that gives autonomy to the individual and allows them to not be tied down really. But also with the PCSK9 inhibitor medications, again, if people have had side effects on statins, then it does, and they meet the criteria for the PCSK9 inhibitors, it gives them another option to pursue treatment. So I think there are a number of benefits for the individual patient. When NICE have looked at the evidence behind these and produced the technical appraisals around them, these are specifically secondary care medications for prescription only. Now, the process in secondary care would be through a hospital clinic, be it a lipid clinic or something similar. Then they would identify patients who may have been referred through a pathway, or maybe they've come through the hospital setting, had a heart attack with high cholesterol or something. Those patients would be then the responsibility of that clinic in terms of the education of the patient and the prescription and the follow-up of the patient. So for patients who have had a single event before, whose LDL cholesterol is above 4 millimoles per litre, and they again have had multiple statin use or unable to tolerate a dose of statin that lowers their cholesterol sufficiently, they will be eligible for the PCSK9 inhibitor. If those patients have had 2 events, so that's maybe 2 heart attacks or a heart attack and stroke, they would have to have an LDL above 3.5, it's slightly lower. There is a separate group of patients, those with familial hypercholesterolemia, who may not have had a heart attack or stroke before. And this is those patients who've been diagnosed with familial hypercholesterolemia. They would be eligible for the PCSK9 inhibitors should their cholesterol show an LDL above 5 millimoles per litre. Those patients who traditionally may have just hit a brick wall after they've had multiple statins and there's no other options, there are other options now. So I think an awareness of thinking about, as an individual had their cholesterol measured as the first thing, and then an awareness to say, well, would this patient need something other than what they've tried before? And then I would refer the individual to the guidelines, and that's where it's not carrying this information around your head, it's just awareness that there are regional guidelines which would help individuals recognise if that patient should either be referred on or could be commenced on something in primary care.